Okay, so we have a couple presentations today. We'll start with Janae, who's going to be sharing some information with us about the elbow joint.
Is the host disabled share screen?
Yeah, it must like set that setting automatically or something. Okay, there you go. Now you should be able to share.
All right. So I'm Janae, and I'm going to be presenting on the elbow joint. All right, so the elbow joint is a space between articular surfaces of the distal end of the humerus and the proximal ends of the ulna and the radius. This elbow joint is enclosed by fibrous joint capsules, so it's a broad, thin, fibrous layer that encloses the capsule. So this is attached to the distal end of the humerus and the proximal end of the ulna, and it's also attached to the annular ligament of the radius, which is over here. I'll talk more about that on the next slide. It has an articular capsule around the elbow joint, and it is attached to the humerus and the ulna and the annular ligament of the radius. This is a synovial joint, so it contains the synovial membrane and the synovial fluid to help support the articular surfaces. This joint is a humeral ulnar joint, so it's a hinge joint, so it allows the flexion and the extension. And it's also a radial ulnar joint, which is a pivot joint that allows the supination and the pronation. All right, and then talking about the ligaments in the elbow, there are three main ligaments that are in the elbow. The ligaments that surround the elbow joint connect from one bone to another, so it provides stability and allowing the motion to occur. So the first ligament I'm going to talk about, I previously mentioned on the last slide. So the articular capsule is attached to the humerus, the proximal ulna, and then attached to the annular ligament, which is surrounding the head of the radius, right here. The annular ligament plays an additionally important role as a primary stabilizing structure for the radial head articulation with the radial notch of the proximal ulna during supination and pronation. Also on the lateral side, you have the radial lateral collateral ligament, which is also known as the lateral collateral ligament. This is like a triangular band of the elbow that connects from the lateral epicondyle onto the ulna, and then it connects to the lateral side of the annular ligament of the radius. And this ligament just helps with stabilizing the elbow. And then over on the medial side of the elbow, you have your ulnar collateral ligament, which is also a triangular kind of shaped band that connects also at the medial epicondyle onto the ulna. And this ligament also helps with support of the elbow joint. So these ligaments are a primary support against this muscle will help you with the actions of supination of the forearm and flexion of the forearm. And the next muscle, the brachialis. This brachialis is the origin is going to be on the humerus, on the anterior distal shaft. And the insertion point is going to be down on the tuberosity down here. And then this muscle is just going to help with the flexion of the forearm. Brachioradialis on the styloid process. This muscle will help with the action of flexion. And then you have your Pronator Teres. As you can kind of tell from the name, the action is going to help with your pronation. This has two origins as well. The first one being on the humerus, on the medial epicondyle, and the other one on the ulna, on the coracoid process, the coronoid process, my bad. The insertion point is going to be on the radius, on the lateral mid shaft. Then the Pronator Quadratus, that's also going to help with your pronation. The origin is going to be on the ulna, on the anterior distal shaft, and the insertion is going to be on the radius, on the anterior distal shaft. The triceps brachii, this also has two origins. One going to be on the long head's going to be on the scapula, on the infragnoid tubercle, and then the medial and lateral heads are going to be on the humerus shaft. The insertion point is going to be down on the ulna, on the olecranian, and then this muscle will give you action of extension of the forearm. Anconius, so the origin is going to be on the humerus, on the lateral epicondyle, and then the insertion point is going to be on the ulna, on the olecranian, and it's going to also be on the superior part of the posterior ulna. This muscle is going to give you the action of extension. And then the last muscle I'm going to talk about is the supinator. As you can kind of tell from the name, it's also going to give you the action of supination. This muscle has two origins, the first being on the ulna, the posterior proximal shaft, and also on the lateral proximal shaft of the radius. So the elbow joint is innervated from median musculocutaneous and radial nerves of the brachial plex. I'm just going to go over the nerves and the radial nerves. So they originate from C5, C6, C7, C8, and those nerves go through the tricep brachii, the brachioradialis, and the supinator, and the aconius. The medial nerves are derived from C6 and C7, and those go through the Pronator Teres and the Pronator Quadratus. And the musculocutaneous nerves branch from C5 and C6, and they go through the Biceps brachii and brachialis. Through your elbow joint, you have your brachial artery, your radial artery, and your ulnar artery. The first injury I'm going to talk about is the nursemaid's elbow, also known as elbow sublation. Sublation basically means a partial dislocation in the elbow, and in this instant, it's going to be the proximal radial ulnar joint. This injury in younger children, usually from the age 5 and younger, and what happens is when the forearm is pulled, a humeral radial joint. So this is what it looks like when it's normal, and then this is when it gets entrapped. When this happens, a child will feel immediate pain, and they will not want to use the injured elbow. The recommended treatment for this is to just not have them use this elbow, and then after a while, it will just go back to normal, and they'll be able to have full use of it. The next injury I'm going to talk about is more common in athletes. usually swinging like a racket or like throwing a ball at a strong outward pace with force in their forearm, and that weakens and ultimately ruptures the ulnar collateral ligament. This will call for a surgical reconstruction, and it's also commonly called the Tommy John surgery. This got its name from the Los Angeles Dodgers pitcher who first underwent this surgery. And the surgery basically is an autograft replacement with a tendon from either the patient's forearm, their hamstring, their knee, their foot, and then they just replace it in the spot where the ulnar collateral ligament was at. The full recovery is likely of 6 to 12 months after rehabilitation. Something kind of crazy that I found out about this is some parents want their children to undergo this surgery so they have a better advantage in their sport. So I don't know, I thought that was just crazy. All right, and then I have my activity. Oh wait, can you see it still?
We're still on your PowerPoint. So you might have to do like a new share, I think.
Okay. Okay. My bad.
There you go.
Can you see it now?
Yep.
All right. So I just found this like quiz on this website, and you just go through it, and it's kind of like a repetitive
lateral epicondyle of the humerus.
Yeah, it just like shows. Oh, my mouse is not working now. And you can just go through and like click which one it's asking you for, and it just kind of repeats and goes through them. So it's just like, you know, repetition. I just thought it was like a good kind of practice of getting to know your elbow joints. I don't know. I kind of had fun just going through it and doing it. I cannot get my mouse to work now. This is awkward.
There you go.
It's like weird because I can't even see my mouse on this end.
Oh, sometimes mine does that when I like hook up to the projector. I don't know why that happens.
Yeah. Like I can't even get it to stop sharing.
Oh, I can do that part.
Oh, okay.
And I think, Janae, you sent me this PowerPoint, right?
Yeah, I sent you the PowerPoint and I sent you the link of that website.
So I'll post the link underneath when I post the Zoom for this so that you guys can go in just like with Sia's presentation last week. So you can click on that quiz and you can go through it. So I'll post that for you guys. So
yeah. It also has like a bunch of like other kind of quizzes, like you can go to the wrist joint, and I think it was just really cool to like have the repetition.
Yeah.
Seeing also.
Awesome. Very good. Thanks. Yeah, that's the Tommy John surgery. That's I've heard that before as well, that, you know, people want to get that surgery because when they repair it, that UCL becomes stronger than what it was to start with. And so it's like, what's the ethical, you know?
Yeah.
What's the ethical dilemma that you put yourself in if you're like promoting a surgery so that an athlete can then be, I don't know, what do you guys think? Is that like an unfair thing, or should we just like let people do whatever they want, or what do you think? This is for anybody, not just Janae. Can you hear me or did I freeze? Can you hear me or did I freeze?
You froze for a while.
So I was just thinking about this Tommy John surgery and how you can get it to make yourself stronger than what you were before. Like, what's the ethical dilemma with that? Like, should we let people do that? Should we not?
don't know. I don't think it's ethical or right, especially like a child. Like, I don't know.
Yeah, you think about sports specialization, at an early age. Other thoughts? What if the kid's like 17 and they really want this because they want to be a pro baseball player? Does that change your mind?
I still think it's like kind of wrong, but I feel like people get like surgery all the time, just like how they get like Botox or like how they get tummy tucks and stuff like that, just so it makes them feel better.
Other
It's just going out of the way to hurt yourself to do.
Well, no, you don't have to hurt yourself to get this surgery. The idea is that the surgery is like going to be an ergogenic aid, so it'll help you.
Okay.
It's usually pitchers, but you can throw, faster now because the ligament is actually stronger because you pull part of a ligament like from your hamstring, for example, which is obviously going to be stronger than something in your elbow.
Okay.
So it's like your own body.
Mm-hmm.
I'm trying to get somebody to debate me and nobody wants to bite.
It's like, what if the family, like, if the kid has, like, been trying to pitch since he was, like, 8 years old and, like, his family can't afford, you know what I mean? Like, that's kind of against the people who maybe can't afford it, I guess.
Yeah, but that's anything in sport. I mean, he could have been, those kids could have been having private lessons and on travel baseball and, like I compete in triathlon and you can buy speed. Like the nicer the bike you have, the nicer the wheels you have on the bike, it makes a huge difference. Are you guys still there or did you freeze? Dang, my internet is not good. So I come to work to use the models and stuff. And that's when I have internet issues. This is not make sense.
You were cut out for 2 minutes.
Well, I was on a roll, Luis.
Yeah, you were like the better the bike, and then it ended.
Well, I saw Val's face not move for a minute. I'm like, oh no, they're frozen. But yeah, I mean, that's you see that in any sport basically. You can buy speed, you can buy, coaching and private lessons and travel leagues and all this stuff. So it's just there is an unfair advantage. That's the thing I like about track and running. There isn't a whole lot you can buy. You're either fast or you're not, so there's not a lot that you can buy that way. So it's, I think, a little more pure than a lot of sports that are maybe more technical, but I still like it all. So anyway, I just think that stuff's interesting. But because my internet is so shitty today, Jelani sent me a video of her presentation because she couldn't come. I will post that as well because I'm not going to risk it not working right now. I can just post it on eLearn and then you guys can watch that. And that'll be on the wrist and hands. Any questions on the practical for tomorrow? I have it set that it should be open from 8:30 till 1. I believe you have 60 minutes to complete it. It's essentially 50 questions, but some of them will be you'll see one model and then there will be 3 questions with that or whatever. Or you'll see one video and then there will be 3 questions. So
is it going to be anything that we've seen already, that we practiced? Obviously it's going to be something that we've seen, but I just know how sometimes different teachers use different like materials to take pictures off of, like of the muscles that they want to talk about. I didn't know where you were like kind of getting the source from, so we can have a better understanding of what pictures to expect.
Sure. Yeah. So a couple pictures came from your presentations. And then all the video, I think there's only a couple videos, but those come from Muscle Premium, the app. And then there's some pictures from Muscle Premium as well. On the labs, I'm trying to remember for shoulder joint, shoulder girdle. I think I pulled pictures from like my little presentations as well. But again, I only chose pictures that I felt comfortable, that were not like tricky. I have no intention of trying to be, you know, trick you or anything else. So I tried to choose images that were clear. But yeah, they came from a variety of sources. Muscle Premium is where I got quite a few of them though. Other questions on anything format related or anything specific?
Is it just like the axial, appendicular, the glenohumeral, and the shoulder girdle?
Yes. Yep.
Okay.
And I try to split them fairly evenly.
Okay.
I don't remember exactly how that ended up, but I usually do pretty, you know, try to keep them pretty even. Other questions on that? I went through our exam 1 from the lecture. Very, very, very good. I think the class average was like 88% or something like that. So excellent job on that. Again, your final lecture exam will be the same format. It's 75 questions, the same setup. So whatever you did this time, do it again next time. Because overall, we did a very good job. Okay. So the next thing I want to do is listed on the schedule for today is lecture 9, upper extremity musculature. And essentially it's just kind of a review for your exam for tomorrow, but also it'll include things from the elbow and wrist joints as well. So I'm going to share my screen. There's no, if you've been using the like handouts that I gave for lecture, there's no handout for this one, but you'll want to like fill in these little charts as we go, if that makes sense. I can't figure out where to put our little faces so that you can still see all the words when this records. Anyway. Shit, am I still recording? Yeah, it is. Okay, sorry. I didn't know since I got kicked out if that makes a difference. It must be okay. Okay. So when we think about upper extremity musculature, hey, Val, tell me if I cut out because you're the person I can see.
Okay.
So again, when we think about our upper extremity, we can kind of divide this into 2 compartments. We have an anterior compartment and a posterior compartment. On the anterior side, we can do elbow flexion, shoulder flexion, and wrist flexion. And then if we think about kind of that posterior compartment, we can do elbow extension, shoulder extension, wrist extension. Okay, so again, if we just kind of think about those in kind of general locations.
You cut out.
Can you hear me now?
Yeah.
Okay. So again, on the anterior side, we can think about those muscles generally as flexors, and on the posterior side, we can think about those generally as extenders. Okay, so starting with the shoulder girdle, again, this should be a review for you. What are the different movements that we can do? So let's see, everyone, show me elevation. Shoulder girdle elevation, shoulder girdle. Shoulder girdle elevation, shrugging up, okay. Depression, drop them back down, okay. Upward rotation and downward rotation are shown in this picture here. So the upward rotation, again, if I want to reach something off a shelf, I got to reach a little bit higher. That'll allow me to do upward rotation. And then to get myself back to that, starting position, that would be downward rotation. Show me protraction. What's protraction again? You didn't know on Monday I was going to be quizzing you on a Monday morning. What's protraction? Retraction? Does that one ring a bell? Retraction?
Then you like push your shoulder blades together.
Yes. So retraction is the same as adduction, where we're squeezing our shoulder blades together in the back. Okay, protraction is when we're pulling them apart, and so that is abduction. Okay, so protraction and abduction are the same. Retraction and adduction are the same. Okay. So let's see if I can break you out into two groups. Let's see, 1, 2, 3, 4, 5. There's 6 of you, I think. I'll put you into two groups and let's see if you can fill in this chart. Again, you'll just put a check mark by, you know, which action can trapezius do, which action can rhomboid do, etc. Okay. So you guys can work together to do that. Let's see if I can. Yeah. Here we go. So go ahead and go to those rooms. We'll get this chart filled out.
I mean, I kind of did a presentation on them, kind of.
We can't see the chart.
Oh, the chart. Yeah. I don't know. I feel like it was just
I have the muscles down, but I don't have all the. Is it just all the regular movements? The 6.
yeah, elevation, depression, downward rotation, upward rotation.
So you can't see the chart once I split you out into rooms?
Correct.
Okay, I wonder if I do this. Now can you?
Oh, yeah.
Yeah.
Okay. Now, I don't know if I leave and go to the other group if you'll still be able to see it. We'll find out. But you can pull it. This is on eLearn too. We're on slide 4 of
Okay.
lecture
Okay.
9. Yeah, I'm going to try and go to the other group and see if that helps. You guys know what you're doing?
Yeah.
Not really.
Well, I didn't realize that the screen would go away if I left you. So this is on lecture 9, slide 4. I know you can see it now, but I don't know if I leave if you can still see it or not. But anyway.
Alrighty. I got it up. Do you guys have it up? Sorry, it took me a minute.
Yeah, mine's up now.
Alright. So we just start with like trapezius and like kind of make our way and see like do like which ones like movements it can do maybe.
Did my image go away?
Yeah, it went away.
Yeah.
Okay. Did you guys get it pulled up on your computers though?
I'm about to pull mine up.
Okay.
There, I think I got it. Hold on.
Okay.
There you go. Awesome.
All right. So
So I think the trapezius, I think it had something to do with rotation, like of the scalp. So I'm gonna go with downward rotation. At least that's mine. Am I on mute? Oh no.
no.
Oh, oops.
Does the levitator scapula, doesn't that do like elevation?
Yeah,
Yeah.
and depression.
Mhm. Um,
Rhomboid, pretty sure that might be protraction. I'm gonna try to pull up my slide.
uh, the pectoralis minor, doesn't it elevation?
Yeah, I think so.
I think it would, but I'm not.
I'm seeing downward rotation of the, it says downward rotation with respect to the glenohumeral.
Yeah.
Does everybody agree with that or no? I don't know if that's right or not.
The downward rotation part?
That's what, yeah.
Yeah. That's one of them.
Okay. So do you guys have 3 for that one and then 4 for the trapezius?
Mm-hmm.
Okay.
So for rhombus, I just have elevation, downward rotation, and retraction.
Yep.
Okay.
Yeah.
Okay, so then this forward rotation of the arm, which would be
Upward.
upward, sorry, yeah.
And then now it does protraction.
How you guys doing?
Good.
From serratus anterior right now.
Okay.
Okay, so we have the, is that it for that one?
I think so. What do you have for it so far?
I just have upward rotation and protraction.
Same. Okay, should we just run with it? Maybe, hopefully we'll go over these.
Yeah.
Mm-hmm. All right.
Pectoralis.
Mm.
Depression, abduction. Depression. Protraction. Downward rotation.
Okay.
That's what I see.
Yeah, that's what I.
Okay. Sure, hang on.
Okay, so then for the last one, the levitator, rotating downward.
Are you guys done or you need more time?
We're still working on it.
Okay.
My class. So weird.
Yeah.
I don't think the pec minor does elevation.
Yeah, I see that it does depression though.
Yeah, I think it's just depression.
I think PEC does downward rotation as well.
And then I don't think this one does elevation. This one here.
Quadratus anterior.
Yeah, because that's the one like on your ribs here on the side. So I could like pull down, but it can't like push up, I don't think.
You're missing one action for serratus, though. You are correct, Jess. It does not do elevation, but it does something else.
Okay.
Does it do protraction? Yeah. That's what it was.
You guys are done? Okay, we'll wait for the other group to get back. I think they're basically done too. Is everybody back? All right, let's see what you got. Trapezius, what does it do?
We had elevation, depression, upward rotation, and retraction.
Yes. Other group, did you have anything different?
Yeah, elevation, depression, upward rotation,
adduction.
Yep.
So, yeah.
Good. Rhomboids, what'd we get?
Retraction, elevation, downward rotation.
Retraction, elevation, downward rotation. Other group, anything different?
We had the same thing.
Good. Okay, serratus.
We had upwards rotation and protraction.
Good. Pec minor.
Depression and abduction.
Yep. Depression and abduction or protraction, right? And levator scapula.
Just elevation.
Yeah, elevation. You might have had retraction as well, but I mean, elevation's the main movement, so stick with that one. Good. Any questions on shoulder girdle? Everybody's okay? Okay. Let's take a look at shoulder joint. Again, let's review those joint actions. So flexion and extension occur in which plane of motion?
Sagittal.
Yep. And abduction, adduction?
Frontal.
Frontal and medial and lateral rotation or internal external rotation?
Transverse.
Transverse and not shown, but horizontal abduction, adduction, which plane?
Transverse.
Yep, transverse. And again, those are this motion here, horizontal adduction and dreamy date, horizontal abduction. Okay. So same deal here. Again, I'll put you into groups. I don't know if it sends you to the same groups or not, but go through, use your lab, whatever you want to use to get this chart filled in. I think I have 2 charts for the shoulder joint. So slide 6 and slide 7. So you can do both of them and then we'll come together to discuss those. Okay.
Is it up? Okay.
This is for the shoulder joint, right?
Yep.
Okay. So for pectoralis major, I have adduction. Oh, you already put that. And internal rotation. I don't know if that's on there.
Would be here.
Flexion. Horizontal adduction. And extension.
Okay. I had the same things on that.
Okay. That one I had extension. And then adduction. And then I had internal rotation.
Okay.
That one I had extension, adduction, and then rotation. And then deltoid, I had abduction.
The deltoid is everything except adduction. Okay.
Yeah.
Okay. But this one I had just internal rotation.
Yeah, same.
Okay.
And that one I just had abduction.
This one I just had abduction.
Yeah,
Okay,
same.
yeah. Alright.
Oh wait, can I take a picture of that?
Yeah.
Okay.
Teres minor.
Teres major.
Would it just do extension?
Yeah. I believe so.
Okay, so teres major.
Extension, adduction, internal rotation. What do you guys have?
Extension, adduction. Same for that one
Yeah.
too. Yeah.
All right. Yeah, I just have like my thing pulled up because I don't know these off the top of my head.
No, same.
Deltoid.
Like everything but adduction, right?
Yeah. Wait. Yeah. I think no. I don't. Hold on. Yeah. What you said.
Alrighty, subscapularis.
That's internal rotation. What else do you guys have for that, or is it just that?
That one. I just have internal rotation.
Okay, yeah, because that's all I have. Valerie, is that what you have?
Yeah.
All right, cool. What's next? Supraspinatus, abduction.
Do you think for bicep brachii it has, oh yeah, the flexion,
Yeah. That one for sure.
abduction?
I don't know if that one does abduction. Or does. I think.
Yeah, I might just do flexion and extension, or I don't know.
Yeah. It does flexion for sure.
Yeah.
Remember, you're only at the shoulder joint right now. So we'll look at the elbow joint next.
Okay.
So yeah, you're right. Just flexion for biceps brachii is what you're talking about, right?
Yeah.
Yeah.
Yep.
Okay.
So would it be just extension for triceps brachii?
Yep.
Okay.
Which one was it? You guys cut out and I couldn't hear.
Oh, extension for tricep brachii.
Okay.
How many more charts of these do we have to do?
I think it's elbow.
Oh, geez, you scared me.
Ta-da! I think we have just elbow, wrist,
Okay, cool.
elbow and wrist. Just a couple.
Alright.
Yeah, this one's the biggest one.
All right.
You guys done with this?
Yeah.
Okay. Kick you back to real life. Everybody ready?
Mm-hmm.
Okay. Back major.
We have flexion, extension, adduction, horizontal abduction, and adduction, and then lateral rotation.
Does it do lateral or medial?
Isn't it medial?
Oh, my bad.
Yeah, I think medial. And then did you say horizontal adduction? Right?
I did say that, but I could be mistaken.
No, that's correct. I just wanted to make sure
Okay.
that's the one you said. Yep. Good. Okay. Lats, the swimmer muscle, what are the three things?
Extension, adduction, and medial rotation.
Extension, adduction, and medial rotation. Very good. Teres major, lats little helper.
It's the same, so extension, adduction, and medial rotation.
Yep, extension, adduction, medial rotation. Very good. Deltoid does everything except?
Adduction.
Correct. It does everything except for adduction. Very good. Subscapularis only does one thing.
Internal rotation.
Medial rotation.
Yep, internal or medial rotation. Very good. Supraspinatus only does one thing.
Abduction.
Yep, abduction. Very good. Okay, teres minor. I got to think a little bit here.
We did adduction and lateral rotation.
Yep, adduction and external or lateral rotation. Very good. Coracobrachialis.
Flexion.
Flexion and
Induction.
Abduction.
adduction. Very good. Now with biceps brachii, triceps brachii, we didn't talk about these in the shoulder joint. These muscles are biarticular in nature. So they cross two joints. So they will assist with what's going on in the shoulder. However, they're not major players in any shoulder movements. So again, when we look at this chart, we're only concerned with what's going on at the shoulder. Biceps brachii does what at the shoulder?
Flexion.
Correct, flexion. Okay, so it's going to assist with flexion. Okay, and triceps at the shoulder.
Extension.
Yes, extension. Very good. Okay, so extension at the shoulder. Oops, sorry. Extension at the shoulder. And then lastly, infraspinatus.
Adduction and lateral rotation.
Yep, adduction and lateral rotation. So it has the same motions as teres minor. So those do the same things. Okay. Okay. So again, when we look at the elbow joint, it is a pretty much it's a strict hinge joint. So it can only do two things. And the nice thing is 100% of the time, if I'm on the anterior side, I do flexion. If I'm on the posterior side, I do extension. The radial ulnar joint, as you know, will do supination, pronation. Another nice thing with the radial ulnar joint is the 3 muscles that work on this joint are named based on what they do. So they tell you exactly what they do. So supinator, pronator quadratus, pronator teres, they tell you which of those motions they do. So a couple nice things that we see with those. Okay, so let's just do this one together. Again, this one should be pretty easy. When we look at the muscles on the anterior side of your upper arm, okay, there are 3 muscles. They all start with B. Okay, what are those 3 muscles from this chart? This is a very easy question. What 3 muscles have B's in them?
Oh,
Brachi, brachialis, and the brachiodialis.
Brachioradialis. Yep.
Oh my.
Yep. So you've got, you can see my screen, right? I'm sharing it, right?
yeah.
Okay.
Yeah.
Wanted to make sure. All right. So we can do flexion if I start with a B. Okay. So elbow flexion is what we're talking about here. So biceps brachii, brachialis, gosh darn it, and brachioradialis are all going to do flexion. Biceps brachii, I believe, can also help with supination. You might have seen that along the way as well. And again, if you are somebody in the weight room, the cool thing about these 3 muscles that work together, these agonists, I can do 3 different types of curls that are going to allow me to focus on a different muscle in each one. So if I do like a regular, what I would consider a regular curl, let me stand up, see if you can see me. So I'm going to start with my hands in a neutral position, and as I curl up and back down, notice that I'm supinating as I go up and down, right? So again, that's going to allow me to focus more on biceps brachii. If I stick with a straight hammer curl, so I'm not rotating my wrists at all, that's going to allow me to focus more on brachioradialis. Okay, so again, just something kind of interesting. We think about, those little modifications that we can make like in the weight room and how that can allow us to kind of focus on one muscle versus another. Okay, 2 muscles on the posterior side of the upper arm. We have triceps and anconeus, and they're both going to do what if they're on the posterior side?
Extension.
Straight up extension, correct. Again, it'll be hard to miss these, but what do you suppose Pronator Teres and Pronator Quadratus do?
Pronation.
They do pronation, and then supinator does
Supination.
good. We didn't need to break into groups for that one. All right. Wrist and fingers, very, very complex in here. I know I've got some people in this class that are interested in occupational therapy, and this is going to be your jam. But there is a shit ton of muscles in these areas. And again, think about anybody do like music or drawing or painting or anything else like that in this group. Think about how much dexterity and how much fine motor control we have to have in order to play the piano or in order to, play the guitar or to paint a picture. All of those things take such minute skill. And so therefore we have like a ton of different muscles that we can modify in order to allow those tasks to occur. Okay. So I will put you in groups for these. So we have the anterior compartment. So again, we're looking at that anterior side of your forearm. And then we have a posterior compartment. So looking at that posterior side. Again, I chose a few muscles from the wrist to kind of focus on in your lab. It's significantly more detailed than that. And again, if you go to grad school for, PT, OT, actually, really anything, PA, you're going to take a gross anatomy class where you will learn all of these muscles in extreme detail. So again, I want you to be familiar with them. I'm not going to go crazy about these though. Okay. So I'll put you back into groups, do both slide 11 and slide 12. Do the anterior and posterior compartments. Okay, let's see. What do we got here? Okay, see ya.
Yeah,
Okay.
I gotta make this full screen and then get to it, I think. Can you see it?
Mhm.
Okay.
All right, so flexor carpi radialis, I had flexion of the wrist, and then abduction.
And then what was the first one? My computer is not good.
Oh, it was flexion of the wrist. Okay, and then flexor carpi. So this one, the next one I had flexion of the wrist. And then I had adduction. And then flexor digitorum superficials. Okay, that one I had flexion of fingers. And then the last one was also flexion of fingers.